Hi, my name is Matt Little. I'm here as the Fab Ambassador for Gloucestershire Hospitals and the Southwest Coordinator for the Fab NHS stuff. I'm just here to introduce a selection of work that we've shared on the Fab NHS website.
The Gloucester Safety and Quality Improvement Academy helps frontline staff take their ideas, develop them and then deliver the improvement required. We do this in a very supportive coaching style and the staff at our hospitals really enjoy the work that they do. What's really important though with improvement is that we also share our improvements, and we do that through a Delivering Improvement Network which the Academy chairs and runs, with also great involvement from right across England, with about 35 hospitals involved with that. Our own Academy website, we share every single improvement project outwardly so people can look and see what we're doing and learn from what our mistakes or where we've had great improvement. The fundamental thing we do though is also upload as much as we can to the Fab website so that nationally people can engage with the work that we're doing.
The changes we've made is the introduction of a surgical assessment unit. We opened the unit as a team in November 2018. Our first month we saw 413 patients through SAU, with 45% being admitted to a bed. The statistics for August this year are 600 patients for the last 2 months, and we now have an admission rate of only 26%. On top of that, we've recently done a PDSA cycle to improve the turnaround for biochemistry results and haematology. We now have SAU on the same level as our emergency department and acute medical initial assessment unit level, and we have a 1 hour turnaround for those bloods. That has reduced the booking time alone at reception by 50%.
We're using the Fab NHS websites and the Gloucester Safety Quality Improvement Academy to help forge the development of this role and seeing how we can use quality improvement methods to get the role to the best that it can be.
The SHED project is all around providing support for dads. So quite often when somebody or a family begin their journey on the neonatal ward, it's never expected or rarely expected, and the care is always quite rightly focused on the mother and the baby first and foremost. And during that time, so often the dads are left on their own, and they spend a lot of time standing around the ward, not always able to help, because if the child's being breastfed, the dad can't get involved in that. So you can do some skin on skin, but other than that, for the dad, a lot of your time is spent driving backwards and forwards to the hospital, and quite often going home at night in an empty car. And when you're going home at night in an empty car, it's a really lonely place to be. So what we're trying to do, thank you Auntie Betty, so what we're trying to do with the SHED Foundation is create a platform that enables the fathers to talk to other fathers that have been through the same experience, that have been on that same journey, and talk in a safe environment, whether it's anonymously through the various platforms we use, or whether it's actually talking to fellow fathers face to face, meeting up on a social event for a beer or a coffee, or just sitting on the ward and having a cup of tea, but being able to talk about your experiences, share that journey, understand that there is light at the end of the tunnel, and knowing that your journey can go from this little boy here to this little boy here, because that's what happened for us.
Because our aim is not only to keep this for Gloucester, but to have it all over England, because I see how much it has not only impact on the fathers, but on the families and on the neonatal staff as well. And we want other units to have the same, to help parents, because happy parents, happy babies.